Welcome to Healthy Living. We're here today at Tidewatch. It's absolutely phenomenal. It is an emergency department. First time I've been here. Beth Long, thank you for joining us.
Yeah.
You are the charge nurse, and I have to ask first, tell me about what your role is as a charge nurse or clinical lead.
Charge nurse, so what you do is you just kind of direct the traffic of the ER, you know. You have the assignments for the nurses, and then of course if someone comes in and they need more attention, you kind of just gather the crew and we focus in on that.
I can tell you, we've been here for about 30 minutes and this is a busy place to be. I've had the opportunity to just watch the flow. This is a well-oiled machine.
Yes, it is.
What are we going to see today?
Well, we're going to walk through here. This is where you first come in.
Okay.
Of course, there's registration, so you'd stop there. You know, they ask you what you're here for, and then ID and such.
Exactly. What's been interesting about that is I've seen probably 4 people come in and the staff has been so gracious. They were helping people in, and you know, you're nervous, I would assume, coming here, but everybody seems to be great.
Yeah, so our goal is to make your worst day kind of an easier day.
Exactly. Talk to me, all right, triage, what does that mean?
So triage is where you come in. We kind of assess you to see where you're at with the acuity of like illness or sickness. So this is kind of get an idea. We get your vitals.
Okay.
You know, check out your heart rate, your blood pressure, and on those busier days, we know like if you're not doing so well, then we'll just
figure out what to do.
Find a
with you right
space for you
there.
and get you back.
Exactly.
So.
Talk to me, if you will, a little bit as we're walking around.
Yeah.
When is a good time for me to come? Who are your patients here? Who are your patients?
Oh, our patients is just, well, just anyone. This is a well-growing area, community. There's a lot of traveling. There are people from all over the place who comes here. Just kind of right there in the center of location and
Well, let me ask you a question. At what point should I come here to an emergency department, to Tidewatch?
well, anytime you feel like you might be having just any abdominal pain, if you feel, you know, like you got this really feeling that you're not sure what it is and you want some reassurance, you know, we got a CT scan, we can scan, we got an X-ray machine, we got the capabilities for blood work.
Okay.
So we got a little bit of everything here.
So again, I use this. This is an emergency department.
It is.
You've got rooms. It's pretty well staffed. I mean, it's
Oh, yeah.
fabulous.
Yeah, it's a well-oiled machine.
You went,
Well-oiled.
yeah, exactly. How many rooms do you have? Do you know?
We have 8 private rooms.
Okay.
And then we have 4 fast track areas where we would put minor things like, you know, toe fractures, sprains, sore throats, or
All that good stuff.
Yeah.
Are you open 24/7? What are your hours?
24 hours a day.
Oh, are you?
We're never
really?
closed. Yeah.
I mean, this literally, I think, is a standalone emergency department, which I think is really unusual.
It is in this area, but you know, it's worked out really well, and we've all come together, the community, and yeah, it's great.
Let's take a tour. I know you've got a couple of the rooms that you've been holding for us. I'd love to take a look inside so they can see how well equipped all these are.
Yeah.
Look at this.
So here, this is one of our private rooms. Also, we would use this for any type of emergency or trauma, cardiac arrest. So we have our crash card and our life pack, which is the ability to, you know, get you resuscitated.
I think what was interesting is we were talking before about when to come. When do you come? And it's basically when you don't feel good. That's
Right.
why this is here, and
Absolutely.
it's so centrally located.
It is, yes.
Do you
It's nice.
get oldsters, youngsters, and everybody in between?
Oh, we're you know, well-rounded. We get everything from, you know, babies to 115.
There, I like you said that. You could, 115 is good for me.
There's no age limit,
I can like-
and there's no height requirements.
What are some of the things that you do as far as services here?
Oh, okay. So services, again, we can go from minor things like sprains diagnosis, splinters, sprains, infection. You know, we have again, capabilities for CT scan, X-rays. We can get ultrasound over here.
Oh, you can.
We can, yeah. And then, of course, we have our own little lab.
So depending on the diagnosis, this is a place where you come and then you either go home or you go on to a higher level of treatment.
Absolutely. We all facilitate that too, getting you to where you need to be and getting you the right treatment.
Thank you for doing this today.
Yeah, yeah.
She is amazing, and we'll have you back again. Stay with us, there's more to come here on Healthy Living.